This video will go over the reconstitution and administration process for TNKase, TNKase. This video is not a substitute for dedicated practice in nursing. Please review the important safety information at the end of the video. TNKase, TNKase, is indicated for the treatment of acute ischemic stroke, AIS, in adults. TNKase is contraindicated in any patients with active internal bleeding, intracranial or intraspinal surgery or trauma within 2 months, known bleeding diathesis, current severe uncontrolled hypertension, and presence of intracranial conditions that may increase the risk of bleeding. For example, intracranial neoplasm, arteriovenous malformation, or aneurysm. TNKase is also contraindicated in patients for the treatment of AIS with active intracranial hemorrhage. TNKase is approved in 25 mg and 50 mg vials. This video will focus on administration of the 25 mg kit. The kit contains one 25 mg vial of sterile lyophilized TNKase powder, a 5.2 milliliter vial of sterile water for injection, and a copy of the full prescribing information. Please be sure to review the included full prescribing information for TNKase. You will need to provide a sterile syringe, gloves, and alcohol swabs. You may also refer to the TNKase dosing card for guidance. TNKase uses weight-based tiered dosing. Use this table to determine the appropriate dose for your patient. TNKase is for intravenous administration only. The maximum recommended dose is 25 mg or 5 milliliters. Initiate treatment as soon as possible within 3 hours of stroke symptom onset. Individualize dosing based on your patient's weight per the table shown here. During and following TNKase administration for the treatment of AIS, frequently monitor and control blood pressure. In patients without recent use of oral anticoagulants or heparin, TNKase treatment can be initiated prior to the availability of coagulation study results. If the pre-treatment international normalization ratio is greater than 1.7 or the activated partial thromboplastin time is elevated, closely monitor patients. Using a sterile syringe, aseptically withdraw 5.2 milliliters sterile water for injection from the diluent vial. Only use the supplied sterile water for injection diluent vial. Please note, if you are using the 50 mg TNKase vial, withdraw 10 milliliters of sterile water for injection. Aseptically reconstitute the TNKase vial with sterile water for injection by directing the stream into the lyophilized powder. The final concentration of TNKase should be 5 mg per milliliter. Slight foaming upon reconstitution is not unusual. Any large bubbles will dissipate if the product is allowed to stand undisturbed for several minutes. Without shaking, gently swirl until contents are completely dissolved. The reconstituted solution should be transparent and colorless or pale yellow. Because TNKase contains no antibacterial preservatives, reconstitute immediately before use. If the reconstituted TNKase is not used immediately, refrigerate the TNKase vial at 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit, and use within 8 hours. Once you have determined the appropriate dose of TNKase, withdraw this volume in milliliters from the reconstituted vial with a syringe. Discard any unused solution. Visually inspect the reconstituted product in the syringe for particulate matter and discoloration prior to administration. Precipitation may occur when TNKase is administered in an intravenous line containing dextrose. Flush dextrose-containing lines with 0.9% sodium chloride injection solution prior to and following single bolus administration of TNKase. Using sterile technique, connect the syringe directly to the intravenous port. Administer the intravenous bolus over 5 seconds. Dispose of the syringe using established procedures. Following administration of thrombolytics, assess and monitor patients according to your institution's protocol. Check for bleeding and signs of hypersensitivity, monitor blood pressure, and perform neurological assessments. Consult the American Heart Association and American Stroke Association guidelines for acute ischemic stroke for more information. For more information, please visit TNKase.com or scan the QR code. Indication: acute ischemic stroke. TNKase, TNKase, is indicated for the treatment of acute ischemic stroke, AIS in adults. Important safety information. Contraindications. TNKase is contraindicated in any patients with active internal bleeding, intracranial or intraspinal surgery or trauma within 2 months, known bleeding diathesis, current severe uncontrolled hypertension, and presence of intracranial conditions that may increase the risk of bleeding, for example, intracranial neoplasm, arteriovenous malformation, or aneurysm. TNKase is also contraindicated in patients for the treatment of AIS with active intracranial hemorrhage. Warnings and precautions. Bleeding. TNKase can cause significant, sometimes fatal, internal or external bleeding, especially at arterial and venous puncture sites. Concomitant use of other drugs that impair hemostasis increases the risk of bleeding. Avoid intramuscular injections and trauma to the patient while on TNKase. Perform arterial and venous punctures carefully and only as required. To minimize bleeding from non-compressible sites, avoid internal jugular and subclavian venous punctures. If an arterial puncture is necessary during TNKase administration, use an upper extremity vessel that is accessible to manual compression, apply pressure for at least 30 minutes, and monitor the puncture site closely. Should serious bleeding that is not controlled by local pressure occur, discontinue any concomitant heparin or antiplatelet agents immediately and treat appropriately. The concomitant administration of heparin and aspirin with and following administration of TNKase for the treatment of acute ischemic stroke during the first 24 hours after symptom onset has not been investigated. Because heparin, aspirin, or TNKase may cause bleeding complications, carefully monitor for bleeding, especially at arterial puncture sites. Hemorrhage can occur 1 or more days after administration of TNKase, while patients are still receiving anticoagulant therapy. In the following conditions, the risks of bleeding with TNKase therapy for all approved indications are increased and should be weighed against the anticipated benefits. Recent major surgery or procedure, for example, coronary artery bypass graft, obstetrical delivery, organ biopsy, previous puncture of non-compressible vessels, cerebrovascular disease, recent intracranial hemorrhage, if not contraindicated, recent gastrointestinal or genitourinary bleeding, recent trauma, hypertension, systolic blood pressure above 175 millimeters of mercury, or diastolic blood pressure above 110 millimeters of mercury, acute pericarditis, subacute bacterial endocarditis, hemostatic defects including those secondary to severe hepatic or renal disease, significant hepatic dysfunction, pregnancy, diabetic hemorrhagic retinopathy or other hemorrhagic ophthalmic conditions, septic thrombophlebitis, or occluded AV cannula at seriously infected site, advanced age, patients currently receiving anticoagulants, or any other condition in which bleeding constitutes a significant hazard or would be particularly difficult to manage because of its location. Hypersensitivity. Hypersensitivity, including urticarial anaphylactic reactions, have been reported after administration of TNKase, for example, anaphylaxis, angioedema, laryngeal edema, rash, and urticaria. Monitor patients treated with TNKase during and for several hours after administration. If symptoms of hypersensitivity occur, initiate appropriate therapy, for example, antihistamines, corticosteroids, or epinephrine. Thromboembolism. The use of thrombolytics can increase the risk of thromboembolic events in patients with high likelihood of left heart thrombus. such as patients with mitral stenosis or atrial fibrillation. Cholesterol embolization. Cholesterol embolism has been reported in patients treated with thrombolytic agents. Investigate cause of any new embolic event and treat appropriately. Arrhythmias. Coronary thrombolysis may result in arrhythmias associated with reperfusion. It is recommended that anti-arrhythmic therapy for bradycardia and/or ventricular irritability be available when TNKase is administered. Adverse reactions. The most common adverse reaction is bleeding. Drug interactions. Drug laboratory test interactions. During TNKase therapy, results of coagulation tests and/or measures of fibrinolytic activity